Coronavirus emerging, here is the most important information. What is the reality regarding the newly discovered coronavirus? A lot of information has been shared about it. The most crucial information is presented here. Where did the new coronavirus start? The emerging coronavirus is a type of virus that infects the respiratory system, and its first outbreak was recorded in Wuhan, China. Investigations and exams revealed that several of the sick individuals had previously visited the fish and animal markets, suggesting a link between animal contact and infection with the newly developing coronavirus. The virus can also travel from an infected individual to a healthy person, which has significantly sped up the spread of the disease in China. It should be noted that there are other strains of coronavirus, including the coronavirus that causes the Middle East respiratory syndrome, which has been controlled and dealt with in the Kingdom of Saudi Arabia in particular. What signs or symptoms does the new coronavirus show? Infection with the emerging coronavirus would be associated with a number of different symptoms, the most important of which are the following: high body temperature, coughing, shortness of breath, sore throat, a headache, nausea, vomiting, diarrhea, fatigue. These symptoms may range from mild to severe, and in turn, the American Center for Disease Prevention and Control indicates that symptoms of the emerging coronavirus may appear approximately 2 or 14 days after exposure to the virus. How does the new coronavirus spread? As we mentioned, there are several types of coronavirus found in different types of animals, such as camels, cats, and others. In general, the previous SARS virus was spread between people through coughing and sneezing, just like the flu, and the new coronavirus spreads through the following: contact with an infected person and inhalation of respiratory droplets through coughing, sneezing, breathing, speaking. Contacting the mouth, nose, or eyes after coming into contact with a virus-infected surface. How is the emerging coronavirus treated? There is still no specific way to help treat infection with the emerging coronavirus, and existing treatments help relieve symptoms associated with the disease. If you think you have been exposed to the coronavirus, it is important that you contact a doctor or emergency room and follow the instructions you receive from them. Are there ways to prevent the emerging coronavirus? So far, there are no specific ways to prevent the emerging coronavirus, so the best way is to try to avoid those infected with it completely. On the other hand, the American Center for Disease Control and Prevention recommends following ways to prevent pneumonia, which include the following: wash your hands frequently for at least 20 seconds with soap and water. If you can't wash your hands, don't touch your mouth, nose, or eyes. Achieving the principle of social distancing, which would reduce the chances of infection with the virus. Use hand sanitizer if soap and water are not available, and make sure that the sanitizer contains at least 60% alcohol. Stay home if you feel sick. Wearing a mask in public places. Thanks for watching.